All right, it looks like we have folks starting to join us. We have one more minute and then we'll kick it off at exactly noon. Just as an update to everybody on the phone call, this is a webinar. It will be recorded. We're actually recording right now, and it will be available to everybody after the meeting today. If you have any questions during the presentation, please feel free to drop them in the chat and we will answer all questions at the end. And then the recording will be available to you via email, as well as the PowerPoint, any handouts that we have from today, and also accessible on the Kinship Navigator's YouTube page and website. So by my watch, we have 12 o'clock exactly. We're going to get started. We've got an action-packed day. So thank you very much for joining us for our June edition of Lunch and Learn. Today, we're going to be talking about kinship caregivers and WIC. We have Misha Marvel here today with us from Hunger Solutions, New York. Welcome, Misha. Thank you for joining us. And just an update from everybody, our Lunch and Learn series, everybody should be pretty familiar with it at this point. We are the third Thursday of every month at 12 o'clock, where we come together and we talk a little bit about a specific feature or service that's available to kinship caregivers to help kinship caregivers and those working with them. We're sponsored by the New York State Kinship Care Coalition and the New York State Kinship Navigator. We do have a recording of all of our Lunch and Learns available on the Kinship Navigator YouTube page and website. And here we have below some of our past Lunch and Learns. Next month, third Thursday of the month, we will be joined by OMH to talk about mental health and kinship care. So look out for a registration for that after today's webinar. I am Ray Glazer. I am the director of the New York State Kinship Navigator. I'm going to give a very brief overview of the Kinship Navigator services for those of you that are not aware. For those of you that have heard me say this a dozen times, bear with me. And then I will turn it over to Misha to talk a little bit about WIC. So the New York State Kinship Navigator, we are information, referral, and education for kinship caregivers all across New York State. We work with local kinship service providers. We work with PRCs, Departments of Social Services. Our main goal is to promote stability and permanency for those caring for children that are not biologically their own through kinship care arrangements. We have a helpline. We're available Monday through Friday, 10 to 4, and a website, www.nysnavigator.org. As I said, we provide information, referral, and education. We have legal fact sheets. We have county resources that are available to kinship caregivers, kinship care resources, legal, aging, youth, county resources. We have fact sheets on every facet of kinship care, mostly legal assistance, financial assistance, education, access to documents. We make referrals to local kinship programs, support groups. We work with legal service providers to provide referrals and one-on-one consultations. We provide education services to caregivers and professionals via statewide presentations such as these. We have an online video archive for Kinship 101, KinGap, Kinship Financial Options, Legal Options. We also chair the KinCare Coalition, which is a statewide advocacy group that meets monthly to discuss best practices in kinship care, as well as to discuss legislative education, as well as the yearly budgets for kinship care. So here's a quick snapshot of our website. Like I said, Monday through Friday, we're available via helpline, but you can also always speak with us online right here. We have people that are available to speak with you 10 to 4 Monday through Friday. You can also contact us via email or our contact form. We also have another piece of the Kinship Navigator called Virtual Case Management, where in addition to information, education, and referral, we have virtual case managers that cover these specific counties in New York State where there is no local kinship program that's funded by OCFS. We work with kinship caregivers for up to 6 months at a time. We help them with benefits applications, referrals, and legal options. And we also provide extensive follow-up, so it is not a one-off, here's your information, here's referral, call us back if you need us. We work very closely with the families to bridge the gap in the 37 counties that do not have a local kinship program available to them. If you're interested or you have clients that are interested in virtual case management, if from one of these counties, you don't have to do anything special. You can just give us a call at the Navigator helpline and we will set you up with a virtual case manager that provides services to that county. The last thing I have is our permission to contact form. If you are working with kinship caregivers, you'd like to get them in touch with us, but you're not sure if they would reach out and make the call themselves, feel free to download our permission to contact form. We'll include it in your handouts today. It is a one-page form that explains the navigator's information and what we do for caregivers. On the back, the caregiver fills out their information, how to best get in touch with them, and we will reach out to them within 48 hours to schedule an intake. It's very helpful for kinship families that are feeling really overwhelmed and aren't quite sure how to access services or may not take a phone call. So the fact that the navigator will reach out to them takes the onus off of that caregiver, and we are able to reach right out to that family. So feel free to download that. If you're looking for any other type of outreach materials from the navigator, we're happy to provide those too. You can always email me directly. My contact information is at the end of this PowerPoint, or call or email the navigator and we'll send that information out to you. So with that, I'm going to turn it over to Misha Marvel to talk a little bit about WIC and how kinship caregivers and how those working with kinship caregivers can seek assistance from WIC. So thanks for joining us, Misha. Over to you.
Thank you. Thanks, Ray. And we did have one person in the chat saying that they're having trouble hearing us. So just wanted to confirm if that's still an issue, or if everyone else can hear okay to connect to audio. Oh, okay.
Deborah, maybe if you turn your speakers up a little bit, that would be great. If you're still struggling to hear, we'll make sure that we send you the PowerPoint afterwards so that you can access to it. Hopefully it's not a technology issue. We can all understand technology issues, can't we, Misha?
Yes, we can. So, okay. Hi, everybody. I'm Misha Marvel, a Child Nutrition Program Manager with Hunger Solutions New York. And thank you so much, Ray. I really appreciate you inviting me to share some updates and context on WIC today, and why it's so important to connect more families with this public health service. If you could, the next slide, please. Before I dive in, for those of you who might not be familiar with us, I just want to introduce our organization. Hunger Solutions New York is a statewide nonprofit and anti-hunger organization, and we focus squarely on USDA's federal nutrition assistance programs. And we work to maximize participation among all who are eligible among all age groups. I've listed these in order in which we've worked on them. We were founded in the mid-1980s and primarily worked on SNAP outreach through the Nutrition Outreach and Education Program, or NOAP, which operates in many counties across the state. If you're not already connected with the NOAP, we have the link to them at the end of this. And my colleague, Kayla Snyder, spoke here on a webinar, I think back in April, about SNAP and NOAP and the new Seniors and SNAP Professional Network that we've started. So I know we have that recording archived as well. So over the years, we've added work on child nutrition programs such as school meals, summer meals, childcare meals, and began work on WIC in 2018 with a 2-year pilot project through the New York State Department of Health. And we recently started a new 5-year targeted outreach contract with the state as well. And so the next slide, the way we go about our mission and much of our work is illustrated here, a combination of community-based services, statewide services, and administrative and legislative advocacy. The elements might look a little different between programs, and the percentage of each element that we work on changes based on our funders' goals. And so the next slide talks about some kind of concrete examples of our strategies. The next slide, thanks. We share information with families about SNAP, WIC, pandemic EBT, and summer meals. We encourage more schools and community-based organizations and childcare providers to participate in the programs that fund healthy meals and snacks. And we advocate to strengthen and expand the reach of the programs, especially through child nutrition reauthorization at the federal level, the Farm Bill, and the COVID-19 response. And next slide. With regards to food insecurity during the pandemic, I'm not going to go into this slide very much in depth. I just want to level set all of us that an estimated 1 in 5 of New York's children experienced food insecurity last year, and more than 1 in 10 of overall New Yorkers experienced food insecurity before the pandemic. And the next slide talks about we have some national numbers that talks about Black and Hispanic households on the next slide. Oh, yes, right, sorry. Thank you. The point being is that Black and Hispanic households experience food insecurity at rates 3 times and 2 times the rate of white households. But thankfully, next slide, there were some temporary policies put in place that prevented this food insecurity from being even worse. For example, all SNAP households are getting the maximum benefit amount as well as additional emergency allotments. Pandemic EBT provided food benefits to basically reimburse school-age children's families for the food that they bought when school was remote. For the past 2 years, school meals have been free for all students in most schools now that school's back in session or in person. WIC boosted their monthly benefit amount of vegetables and fruit in the WIC food package from previously $9 or $11 a month to currently $24 per child and $43 or $47 per mom, depending on if she's pregnant or postpartum or breastfeeding or not. And also WIC provides remote services now. And then there were some flexibilities allowed for grab and go service when other child nutrition programs weren't running in person. But all of this, we know that some of these are temporary policies and they're going to expire just as this school year ends right now, and that many families are going to face food hardship within weeks. So on the next slide, all of the programs that have helped families, I'm going to be focusing on WIC today because just in the very crucial role kinship caregivers have with young children. We all know there are many reasons why a child may need to live with a grandparent or a relative or a foster parent. And, one thing is certain, there are services that can help make life easier for them. And WIC is one such program. It provides healthy food, nutrition advice, and referrals to helpful programs for children up to the age of 5. Any adult who is providing a home for a child under the age of 5 can apply on behalf of that child, whether the arrangement is legal or informal. And children need nutritious food and a healthy diet to thrive, and WIC can help. So I know that some of you may be very familiar with WIC from years past, or even might have been a WIC participant yourself. But I'm just asking, please don't tune out from what I'm going to be sharing over the next few slides. I'm sharing these things because community partners have, who are working with eligible families, have told us time and time again over the past few years that they just didn't know what I'm going to share with you, and they didn't know that WIC was really so underused. And we want to make sure that you know about the improvements to WIC's public health service over the past few years. And so the next few minutes, I'm going to dig into these 4 talking point buckets a little, talking about how it's a public health service, the recent modernizations of WIC services like the eWIC card and the WIC to go app, flexibilities and the enhanced benefits due to the pandemic, and participation rates in your area, and in all in the context of what you can do to help. So let's dig in. The next slide, thanks. So we know that proper nutrition is vital for all phases of life, especially before birth and through a child's 5th birthday. Obesity in childhood can begin before a child is born. Gestational diabetes, excess maternal weight gain during pregnancy, and a high birth weight can all increase the child's risk for becoming obese. WIC helps reduce these risks by promoting healthy eating and providing nutrition education for pregnant women and in children younger than 5, right? And WIC's focus is improving access to fresh and nutritious foods in the communities where participants live. And participation in WIC is linked to just better overall dietary quality, increased consumption of fruit and vegetables, and a reduced intake of added sugars. And so depending on the participants' nutritional needs, their WIC, just to give you a sense of what a WIC approved, WIC foods might be, some WIC approved a food package items could include food staples such as protein, of course, right? Eggs, peanut butter, canned or dried beans, tofu, canned fish. There's dairy, whether it's milk or yogurt or cheese, or dairy alternatives like soy milk. whole grains, pasta, brown rice, hot and cold breakfast cereals, tortillas, bread, whole bread, fruits and vegetables, whether it's fresh or frozen or canned, just as long as it's canned in juice, 100% fruit juice, and then baby food, whether it's jarred fruits or vegetables and meats, infant cereal, and infant formula, which has been on the news and is a crisis at this moment. And then in addition, a WIC participant's food package is customized to meet some special dietary and cultural needs. So vegan, kosher, halal, for example. But just overall, WIC is just a tremendous public health service. In fact, a recent national report I have linked here on the state of WIC shares that the return on investment for WIC is $2.84 for every $1 invested. And so on the next slide, this is also why we're talking about WIC today. Even before COVID, many eligible people were not participating, especially pregnant women and children, particularly ages 3 and 4. And we're really hoping that kinship caregivers in your network of caseworkers can help get the word out and connect with WIC so that more young children and families can benefit from WIC. I'm going to show you next the coverage rate for WIC across the state and how it's different among various types and age groups. So on the next slide is going to be a map. Yes. So across New York, right, or throughout New York, as we know, WIC is administered by the State Department of Health. And this is the coverage rate map for 2019, and it was prepared by the state agency. In counties that are shaded green, more than 50% of eligible households were participating in WIC. Yellow shows 41 to 50% participation, orange is 31 to 40%, and red is the worst at less than 30% of eligible households participating. So in 2019, Department of Health estimated that WIC's coverage rate statewide was 50.4%. And we can see that nearly half of our counties had really less than 40% participation. The most recent participation data from the State Department of Health has not seen a significant increase in new enrollment since the pandemic. And then the maps we're going to go through quickly now show local participation among various age groups of WIC. So can we do the next slide? So here we have women. So this is women of whether they're pregnant or postpartum or breastfeeding or not. And then the next slide, we can see this one's children. Yep, can we back up one? For women and back up one? Infants, right, okay, so infants, we have the highest participation rate, around almost 80% statewide. And then you can, so the infant participation rate is the age group or the target population, which has the highest participation. And then we can see the difference, sorry, next slide. Right, so women, you can see the difference and a decrease in participation among women. And then the final slide is with children. So after age 12 months through age 5, is at the lowest rate. You can just see we have some work to do to ensure more families and especially pregnant women and children are connected with WIC. And especially because, we know that COVID hit soon after the data on these maps were taken and that the need has risen. And at the same time, we know that participation in SNAP and Medicaid increased, but WIC really did not in terms of new enrollment. That said, the participation rate among current participants improved somewhat since COVID with fewer missed appointments. And that's thanks to, because of COVID, a remote services option where families don't have to go into the clinic in person, but can apply and receive nutrition education remotely over the phone. And they can send in their documents electronically as well. And then the next slide, I'm going to take just a few minutes to share some basic information that we hear from partners that need some reminding and some repeating, and then also some updates on WIC. And so just as an example, as this little girl is so excited about, participating in WIC has never been easier. And she talks about getting WIC benefits at home, and that speaks to the remote services. And then the next slide. So who's eligible for WIC, right? So someone may be eligible for WIC if they're pregnant, a mom of a baby who is up to 6 months old, a mom of a breastfeeding baby who's up to 12 months old, or a child under the age of 5, which is really why I'm here talking with you. So of these eligible groups, you remember from the maps that I showed, pregnant women and children have the lowest participation in the coverage rates among all the possible participants. And the next slide. To get WIC, a mom or a child must simply live in New York State and have income below a certain amount, which is 185% of the federal poverty level. So right now, the rates just changed. So right now, that's over $42,000 for a family of 3, or over $53,000 for a family of 4. Or if they get benefits from SNAP or Medicaid or TANF, that makes them automatically eligible for WIC too. So, and a person's immigration status is never asked and never considered. So the public charge rule does not apply. And this has still been a great concern for communities, even though just in terms of a myth in the area and a scare for families. And then the next slide. And then the reason why I'm sharing this all with you today is something that really just isn't well known, right? Dads and single dads and kinship caregivers and foster parents, guardians, step parents, they all can apply for WIC on behalf of the children in their care. And here's some examples of some outreach materials that we have available for partners to use. Next slide, please. And then this slide shows a photo of an eWIC card on the left and the main screen of the New York State WIC to Go app on the right. I share them because New York finished a 1-year-long statewide rollout of eWIC in the summer of 2019, thank goodness. And we are still hearing that people are not aware that the WIC food benefits are no longer provided on paper checks like they were previously. And I guess, this kind of makes sense really with the pandemic starting not really soon after eWIC started. But if you're familiar with the WIC program from before 2019, this is really good news for families and for the WIC program. Like I mentioned, before WIC food benefits were issued on paper checks and a family had to buy everything on their food list all at once. That's not the case anymore. The eWIC card acts just like a debit card that is swiped at the register. Families can shop when it works best for them. They can do it all at once if they want to, or they can go back to the store as many times as they need until they use all of their benefits by the end of their 30-day WIC cycle. And so due to the pandemic, as I mentioned earlier, many local WIC clinics are allowed to provide services remotely over the phone or video chat. And so they're also allowed to load those eWIC cards remotely as well. And that includes increased monthly benefits for fruit and vegetables that I spoke about now for $24 for a child or $43 or $47 for a mom. And then the next slide shows a photo of Wanda, the newest modernization for New York State WIC. Wanda is officially called a virtual assistant. Some call her a chatbot. She's got a reader-friendly and a very chatty tone. She asks potential participants questions that pre-screen for WIC eligibility, and she can also share some information for current participants as well. In about 3 minutes for a potentially eligible New Yorker, families can learn about WIC services. They can find out if they are probably eligible, and then they get referrals to WIC clinics near them. You can even give permission to Wanda to give your contact information to your local WIC clinic or WIC agency so that the agency will follow up with you within the next day or so, the next couple of days. So it's really a warm referral. Wanda is easy to use on a computer or a tablet or a phone. Wanda is still in a pilot phase right now, and so is in English only. New York State WIC really hopes, we all do, that the State Department of Health will be able to add more languages when the pilot phase is over next year. And then to make it easy for partners to help spread the word about Wanda, there's some flyers, a postcard or a palm card size material with a QR code embedded that will take you to Wanda, and a variety of sample social media posts that are all linked on the wichelpny.org resource center. And I'm going to put the link to that, is embedded here on the slide, and then I'm going to put the link to that in the chat at the end as well. And so, talking about WIC Help New York, on the next slide, actually, when people visit the website, they can find basic and, you'll find basic and reader-friendly information about WIC. And our website is translated into 10 languages. We also include the state's, the Department of Health's Growing Up Healthy hotline. And there's also here the link to all the WIC all the WIC agency contacts, and of course, a link to Wanda. And then we also, a little lower on that page, also link to a short video on how people will actually use their eWIC card in the store. And then in the resource center portion of the site, there's just really a whole variety of different outreach pieces and fact sheets, including several of them are in Spanish right now, and all available for partners' use. And we're going to be adding much more resources and also in additional languages. So we just ask, please keep this resource center in mind with the families that, with your work. And then also please, sign up for our e-news around child nutrition programs or WIC, so that you'll get alerts whenever we've added more resources. And I'll put a link to that the subscribe link in the chat as well. So the next slide, just to recap, New York State reaches about half of eligible New Yorkers, but reaches many fewer outside of New York City. And among age groups other than infants, pregnant women, children ages 2 to 4, and children in the care of non-maternal caregivers are especially underserved. And we have a variety of materials you're welcome to use to help spread the word on the wichelpnewyork.org resource center. We are hoping, I did see somebody put in the chat about some benefits or flexibilities to be extended. We are also hoping and advocating that the current fruit and vegetable boost, which currently expires September 30, will continue to be extended by Congress, as they have every few months since last summer when it got put in place. Even better, that boost will be made permanent. But if they don't get extended or made permanent, then that fruit and vegetable benefit reverts back to the original amount of $9 or $11 per child or mom per month. Let's see, and then, please reach out to your local WIC clinics and create a referral partnership with them. We have the links to them on our website, and we're also very happy to help facilitate that connection. As I mentioned, that wichelpny.org main page includes a link to local WIC clinics as well. And then, on the next slide, we know that everybody here knows that people need to hear and see and read things multiple times from multiple trusted messengers before they reach out and connect with nutrition programs. And we know that you could be that, trusted messenger for the families and the communities that you serve. So wanted to make sure that I included all of the websites that we manage. They all have a variety of outreach materials that are tailored to the appropriate audience, whether it's families or schools or providers and potential sponsors. So, for example, foodhelpny.org would connect you with your local NOAC coordinator for SNAP outreach to families that you serve. The Summer Meals NY, help with summer meals outreach using resources. This summer, there's a new texting hotline where anyone can text 304-304 and get a list of the local summer meal sites closest to you. I gave a shout out to my colleague earlier about our new SNAP and Seniors Professional Network. So, please join that. And, share information and resources with schools or community-based organizations with regards to school meals and childcare meals as well. And then the final slide I think I have, so the final slide, thank you so much to Ray and for everybody, but thanks to Ray for inviting me to share all this background and some updates. Thank you to everybody here today, either listening or, listening later, for all that you do to support families in your community. we're very much looking forward to working with you all and just hope that you consider us as partners in your very, very critical work with your families. You can always connect with us directly. Again, I encourage you to sign up for our email alerts. I'm going to put that in the chat right now. You know, and we're very active on Facebook and Twitter and Instagram. So, and we have some stuff that you can easily reshare out on your channels. So, and I'm happy, I know we're kind of at time, but I'm happy to stay on as long as we have some questions. Thank you.
Misha, thank you so much. That was extremely helpful. I did see some people coming in on the chat to say thank you as well. Very helpful, very informative. We will absolutely send out the PowerPoint. There's a lot of good information there, a lot of good links for folks to take a look into.
Yeah.
We are 1 minute till 12:30. So if anybody has any questions that they'd like for Misha to answer right now, feel free.
I will give a shout out to, with regards to Wanda, and I mentioned a palm card postcard situation. We have those, and I'm putting right here in order form. We have those available for partners to order in bulk for free of charge to you if you just fill out this order form. And within 2 to 3 weeks, that shipment will be mailed to you in the wherever you would like it sent to. So if you have that makes sense, if you're seeing people in person, if that's a resource that would be helpful, you're free to order that. Currently, that's the only item that we have available that is for bulk order, but we will be creating, you know, everything else is available for you to use and share out as you can. And then this last piece is the subscribe link to our e-news, just so that you'll get updates as we send them out to everybody.
That's fantastic. And we'll have our publicists share those links as well for ordering the palm cards and subscribing to the newsletter when we send our email with the PowerPoint. So we are right at 12:30. Thank you so much, everybody, for joining us today. We really absolutely appreciate it. We will be back on July 21st at 12 o'clock to talk about kinship caregivers and OMH. So we'll look for that information on how to register coming across to you shortly. We do have 2 questions coming in through the chat right now. So Misha, if you still have a minute, we can address.
Of course, absolutely, yeah.
The first one's coming to us from Eve Moses. She runs a support group for kinship caregivers and is wondering how we can help tell kinship families who are often overwhelmed and can't navigate the computer.
Oh, of course. Right. So there's a couple of things with regards to, you know, if you were able to sit down, if you want to check out Wanda yourself, right? So in 3 minutes, you can kind of walk through and see how easy it might be for somebody in terms of how easy it is for them to use that and make a judgment, you know, based on that. But you're also, if you have the capacity to do that, you're invited to sit with somebody and fill it out with them or for them, if that's something that you're able to do. And then what happens is that the local WIC agency then calls that person and goes through the process over the phone with them. So I don't know if that was maybe, I'm hoping that might speak to your question. WIC is not an actual online application. It's kind of an in-person, quote unquote, in-person application. And then there would be some documents that need to be submitted to the local WIC agency. But it's not that somebody has to fill out the application online.
Fantastic. Yes, Eve said, yes, thank you.
Okay.
And then the second question we have a biological parent that has WIC established, but is now incarcerated and the grandparent is petitioning for custody. What does the grandparent need to do to switch WIC to her name? And actually, even to make this a little bit broader, I would think this would apply in any circumstance where the parent already has WIC established. How do you transfer?
The parent already has WIC established, but now the parent is incarcerated. So then the parent is no longer, so that would be a conversation. I don't know, I don't have the answer to that. That would be a conversation with your local WIC agency. And then they would be able to walk through that process. Obviously, if the parent has WIC established and it's in their name, but they're not able to participate in the program or purchase the food for their child, then there needs to be a switch in that system. So that needs to be shared and reported. And But it's a conversation with the local agency to get that done.
For sure. I think we would see a lot of caregivers that are facing similar circumstances where the parents might have WIC set up, and now that they're caring for the children, they need to get that transferred over to them. So reaching out to the local WIC office is the way to go for that.
Mm-hmm.
Okay, fantastic. Those are our questions for today. Thank you, Julie. Thank you, Eve, for chiming in with those questions. They're great ones. And we're going to wrap it up at this point in time. If anybody has any follow-up questions for Misha, her email is right here. You'll get this in your handouts, or you can always feel free to reach out to the navigator, and we will connect with Misha to answer those questions. So thank you again for joining us today. We really appreciate it. And thank you, Misha, for the excellent information. And
Thank you, Ray. Thanks.
We'll
Have a great day, everybody.
All right. Yes, thank you.